Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk about spotting autism early in your child. As you know, autism is a neurodevelopmental disorder with abnormal functioning in social interaction, social communication, and the child also has repetitive odd behaviors. It can be diagnosed much before the age of 3 years, and it's important to know this because early diagnosis leads to early intervention, which then gives rise to better prognosis. As you know, 30 to 40% of these children can come out of the diagnosis, and hence early intervention is the key. What are the important goals of assessment? Apart from a complete diagnosis which requires detailed history taking and observation, a precise documentation of the child's functioning is needed so that when we are doing therapy, we know how the child is progressing. It is also important to look for presence of comorbid or associated conditions, both medical and psychological, like ADHD. So when we assess autism, we look at the developmental and intellectual abilities, both in verbal and performance areas. We look at the child's social competence. Depending on the child's age, whether it's an infant, whether it's a toddler or preschooler, we look at the social competence accordingly. We look at receptive and expressive language, again depending on the age of the child. And then we look at the social use of language, which is also known as the pragmatics of language in these children. Because many children with autism may have large number of words, but they don't use them to communicate. We also look at self-care and adaptive skills, because this will make an important part of management. The other things we look at are the medical conditions like PKU, which is a very important metabolic condition which can be prevented by early dietetic treatment, Fragile X, which is a genetic condition, tuberous sclerosis, Rett's disorder, Down syndrome, and epilepsy. We need to treat this. We also look for things like ADHD, mood disorders. So if the child is hyperactive, it needs to be treated. If the child has very severe OCD or self-injury or very significant stereotypy or mood problems, these all need treatment. So that's why they must be documented. Detailed developmental and health history therefore is very needed. The examination includes observation of the child during structured and unstructured periods, testing the child's social and communication abilities, play skills, including symbolic play or what we call representative or dollhouse play, the child's motor behaviors, and of course behavior problems. Some of the diagnostic instruments used are CARS, the Autism Diagnostic Interview, the Autism Continuum Scale, and the ADOS. I am certified in the ADOS, which is one of the gold standards of diagnosing autism, and it's actually testing the child by giving them different opportunities to communicate and then documenting this and converting it into numbers so that it gives us a diagnosis. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.